Hello staff, Stephanie Rumpel, CEO, ABC Medical Center. Tonight I'm going to discuss with you the EHR system that we will be implementing into our facility. EHR stands for Electronic Health Record, and it's basically a digital version of a patient's paper chart. It includes real-time patient-centered records that are available instantly to anyone that has secure access. So no more searching around for paper charts. Everything's going to be right in front of you on your computer screen. If a patient comes into the ER, has ABG, EKG, CAT scan, when the doctor comes in, the results will be right there on the computer for him to look at, analyze, and go over and discuss with the patient in real time. No more waiting for results. They'll be right there in the computer real time. It'll also help us reduce medication errors. We'll have to scan in medications, scan in a patient's wristband. That way we make sure it's the correct patient and it's the correct medication and the correct dosage. We will also be scanning patients to do their x-rays, their CAT scans, their ABGs. That way we're ensuring that it is the correct patient that we're doing the correct test on. So that's going to help with so much errors. It's also going to help us become integrated with our patients a lot more, and also give our patients the power to manage their health care from home. Now, with the pandemic among us, COVID-19, we are doing more and more telehealth visits, which is making us, we're having to do everything twice, having to do it in their paper chart, and then having to put it in a computer system. So now with the new EHR, if a televisit is done, it'll be integrated into the EHR system, and you won't have to chart it twice. It will already be integrated into the patient's medical record in real time, just as the chest x-ray result or a CAT scan result or any other result would be. This is so crucial in the middle of the pandemic, and it's just going to, I believe, boom from here. I don't believe when this pandemic is over that telehealth will be over. I believe it's going to continue, and it's having it integrated into an electronic health record is going to make things a lot easier for us, the clinicians, as well as the patients. Let's talk about the patients now. The patients are going to be able to, as I said earlier, manage their own health care from home. Now, what's going to happen with these EHR systems is the patient will be given a link to what's called My Portal. When they are at home, they'll be able to log into this portal and they will be able to see their medical records. They will be able to view the results, print out the results so they can take to another physician if need be, to be seen once they get home. It also allows them to track their progress with weight, or whatever they're trying to track their progress with. But whatever happens, they'll be able to get onto their My Portal, sign in, and be able to see everything in real time, just as we would with our EHR system. They'll be able to schedule appointments, schedule all their surgeries. They'll be able to fill out all their paperwork right online in the My Portal. And that will save so much time when they come in for their appointments. Their paperwork will already be filled out. You'll already have copies of their ID, their insurance card, everything that you need prior to the appointment you will already have. So that will also cut down so much on time as well as waiting. Other great things with the EHR that will be able to help with patient integration is remote monitoring, my mHealth apps, other technology, which basically is just a great breakthrough for medical technology. So let's say that we discharge a patient who's going to go home. we're kind of worried about their heart rate, or, they just need to be monitored, their heart rate, anything that we need to be monitored, we can be able to do that now from their home. That's integrated directly into this app. So basically, if a patient's a diabetic and the doctor would like to keep an eye on their blood sugar results, the patient can take their blood sugar results and download it into this app, and the physician is able to look at the results and able to see a trend or able to see anything that might concern him and be able to talk to the patient about, which this is just excellent news for anybody. There's a lot of people that live in rural communities out there, and trying to find transportation into hospitals, especially if it's an hour or two drive, can be really hard. So I believe all this remote monitoring and telehealth is just going to be amazing breakthrough for healthcare coming up, and the fact that we already have the technology is going to be great. Also, we were able to use this technology. We're also able to integrate social media with it. So in our app that will go with our EHR, we will also be able to do education videos. We'll be able to reach out to our patients, and through social media, we can help with smoking cessation. They can download apps for COPD, so they're able to track and monitor their peak flow rate, their oxygen saturations. Diabetics will be able to monitor their blood sugar, their insulin. Everything can be tracked and downloaded, these apps, and then sent over to the physician for the physician to review and give advice to the patient if need be, all without the patient coming into the office or having to come into the hospital. So that's a big breakthrough. Like I said, in medical technology, it's going to make things so much easier for patients, for clinicians, and I believe even after this pandemic is over, it's something that is going to continue with the mobile health apps, with the patients be able to really track their health and be able to take control of it at home and be able to watch their nutrition, be able to, like, as I said, just track their blood sugar, send it to their doctor, their blood pressure. Patients at home on home health ventilators will be able to do telehealth visits, talk to their providers now via these mobile apps. The providers will be able to track their ventilators, heart rate, whatever they need to do through these monitoring devices. Then we can do that remotely now. So that is, as I said, is just a major breakthrough. So I know change is always difficult, learning new systems and learning how to implement them in patient care. However, this is something that will be better for all of us in the end. We will be able to get through this, and I believe you will see as well as I do how much better this is going to be, and patient outcome and patient care. This is really going to be a new breakthrough technology. Also, with these new EHR systems, we are able to share all the information electronically. So if a patient was to go to another hospital up in California somewhere, they would be able to access their records and be able to see what happened last time they went to the hospital, what they had to do, what their doctors are, what they're being treated for, allergies, medications that they're on. It's going to make things so much better. Well, I hope you enjoyed this video, and we will see you soon.